Welcome to Primal Health. Today, we are going to take a deep dive into a silent epidemic that plagues 97 out of 100 people. Be sure to watch until the end, where you will learn how iodine affects immune function in the body. Iodine is an essential element that plays a pivotal role in the health of every cell in the human body. Despite its significance, iodine deficiency is alarmingly widespread, affecting over 97% of the population. This video will explore the critical role of iodine in human health, the consequences of iodine deficiency, and the measures needed to address this pressing issue. Drawing on insights from Dr. David Brownstein, a world-renowned expert in iodine, we will delve into the reasons behind this deficiency. We'll study its impact on various health conditions and the solutions available. Iodine is indispensable for the synthesis of thyroid hormones, which regulate metabolism, growth, and development. And these hormones, thyroxine, T4, and triiodothyronine, T3, are essential for the proper functioning of many organs and systems in the body. Thyroid hormones influence the metabolic rate, body temperature, and overall energy production. Without adequate iodine, the thyroid gland cannot produce these hormones, leading to a cascade of health issues. Beyond thyroid hormone production, iodine is crucial for the synthesis of other hormones, including those produced by the ovaries, pancreas, and adrenal glands. If you like this video, please subscribe to Primal Health. Iodine also supports the structural integrity of glandular tissues, preventing the formation of cysts, nodules, and ultimately cancer. Iodine's role in maintaining cellular function extends to its antioxidant properties, which protect cells from oxidative stress and inflammation. Dr. Brownstein's extensive research indicates that iodine deficiency is a widespread issue, with over 97% of the population not getting enough iodine. This deficiency has significant implications for public health, contributing to a range of glandular problems, autoimmune diseases, and cancers. Iodine levels in the US have fallen by over 50% in the last 40 years. This coincides with a marked increase in thyroid disorders, breast cancer, prostate cancer, and pancreatic cancer. Dr. Brownstein emphasizes that iodine deficiency may not be the sole cause of these conditions, but it is a substantial contributing factor. Iodine deficiency can lead to a host of health problems, the most well-known being hypothyroidism. Hypothyroidism is characterized by an underactive thyroid gland, which leads to insufficient production of thyroid hormones. Symptoms of hypothyroidism include fatigue, weight gain, depression, dry skin, hair loss, cold intolerance, constipation, and muscle weakness. These symptoms can significantly impair quality of life and, if left untreated, can lead to more severe health issues, including heart disease and infertility. A visible consequence of severe iodine deficiency is goiter, a condition where the thyroid gland enlarges in an attempt to capture more iodine from the bloodstream. This enlargement can lead to discomfort, difficulty swallowing, and breathing problems. Additionally, iodine deficiency can cause the development of thyroid nodules, which are lumps within the thyroid gland. While most thyroid nodules are benign, some can become cancerous over time. Iodine deficiency affects reproductive health, particularly in women. It can lead to ovarian cysts, uterine fibroids, and an increased risk of breast cancer. Dr. Brownstein notes that the incidence of thyroid cancer, breast cancer, and prostate cancer has surged as iodine levels have declined. He also points out that iodine deficiency can lead to other types of cancer, including pancreatic cancer, which he now sees in younger patients, a trend that was rare 30 years ago. Pregnant women are especially vulnerable to the effects of iodine deficiency. Adequate iodine levels are crucial for fetal brain development. Iodine deficiency during pregnancy can lead to cretinism, a condition characterized by severe physical and mental retardation. Even mild iodine deficiency in pregnant women can result in lower IQ levels and developmental delays in children. One might assume that iodine deficiency could be easily addressed through diet. The primary natural sources of iodine are seafood and sea vegetables, such as fish, shellfish, and seaweed. Dairy products, eggs, and iodized salt also contribute to dietary iodine intake. However, modern dietary habits and environmental factors complicate this solution. The widespread use of processed foods, which often lack iodine, has contributed to the deficiency. Environmental factors further exacerbate iodine deficiency. The widespread use of bromine and fluoride, both of which can displace iodine in the body, is particularly problematic. Bromine is commonly found in baked goods, sodas, and as a flame retardant in various consumer products. Fluoride is prevalent in drinking water and dental products. These halogens compete with iodine for uptake in the thyroid gland and other tissues, reducing the amount of iodine available for hormone production. Conventional medical practice often fails to diagnose iodine deficiency correctly. Many doctors rely solely on thyroid-stimulating hormone, TSH levels, to diagnose thyroid problems. However, TSH alone is not a comprehensive indicator of thyroid health. A high TSH level typically indicates hypothyroidism, but a normal TSH level does not necessarily mean that thyroid function is optimal. Dr. Brownstein advocates for a comprehensive hormonal evaluation that includes tests for T4, T3, reverse T3, and thyroid antibodies. He emphasizes the need for a more nuanced approach to diagnosing and treating thyroid disorders, one that goes beyond the limited scope of TSH levels. Dr. Brownstein's approach to addressing iodine deficiency involves not only supplementation, but also a holistic treatment regimen. He recommends using a combination of iodine and iodide, such as Lugol's solution or iodoral tablets, which different tissues in the body utilize. He also stresses the importance of adequate salt intake, as sodium is necessary for the proper absorption and utilization of iodine. This approach has yielded significant results in his practice. It reduces the need for thyroid hormone replacement in many patients and improves overall health outcomes. Dr. Brownstein's clinical experience provides compelling evidence of the benefits of iodine supplementation. He recounts cases where patients with glandular problems, such as thyroid nodules, breast cysts, and prostate enlargement, have seen remarkable improvements with iodine supplementation. In some instances, cysts and nodules have shrunk or disappeared entirely. He also highlights the case of his own daughters, who were diagnosed with Hashimoto's disease, an autoimmune thyroid condition. And through iodine supplementation and holistic treatment, their condition was reversed, as demonstrates the potential of iodine for treating autoimmune thyroid disorders. Addressing iodine deficiency on a broader scale requires a multifaceted approach. Public health initiatives should focus on raising awareness about the importance of iodine and promoting dietary sources rich in iodine. Additionally, policies to reduce the use of bromine and fluoride in consumer products and drinking water could help mitigate the displacement of iodine in the body. Educational campaigns could inform the public about the importance of iodine and encourage the use of iodized salt and the consumption of iodine-rich foods. Despite the promising results seen in clinical practice, more research is needed to fully understand the role of iodine in health and disease. Large-scale clinical trials are necessary to validate the benefits of iodine supplementation and to establish standardized treatment protocols. The decline in iodine levels over the past decades is partly due to changes in agricultural practices and food processing. Soil depletion of iodine due to modern farming techniques has reduced the iodine content in crops. Moreover, the increased use of chemical fertilizers, pesticides, and herbicides has further diminished the natural iodine content in the soil. As a result, even foods that were once reliable sources of iodine now contain less of this essential nutrient. Historically, iodine deficiency was a significant public health issue, particularly in regions far from the sea. The introduction of iodized salt in the early 20th century significantly reduced the prevalence of goiter and other iodine deficiency disorders. However, in recent years, there has been a decline in the use of iodized salt, partly due to the popularity of specialty salts like sea salt and Himalayan pink salt, which may not be adequately iodized. Additionally, public health messages to reduce salt intake to manage hypertension have inadvertently led to decreased iodine intake. Iodine also plays a crucial role in immune function. It is a potent antimicrobial agent, effective against bacteria, viruses, and fungi. Iodine is used in antiseptics and disinfectants because of its ability to kill pathogens. In the human body, iodine contributes to the immune response by supporting the activity of neutrophils, a type of white blood cell that helps fight infections. Adequate iodine levels are therefore essential not only for hormonal balance, but also for robust immune defense. Another critical function of iodine is its role in detoxification. Iodine helps the body eliminate toxic halogens, such as bromine and fluoride, by displacing them from receptor sites and facilitating their excretion. This detoxifying effect of iodine is particularly important in modern environments where exposure to these toxic halogens is pervasive. Dr. Brownstein's practice often includes protocols for detoxification, which involve ensuring adequate iodine intake to help the body rid itself of these harmful substances. The impact of iodine deficiency extends to psychological and cognitive health. Iodine is essential for brain development and function. Inadequate iodine levels during pregnancy and early childhood can lead to cognitive impairments and developmental delays. In adults, iodine deficiency can contribute to mental fatigue, depression, and cognitive decline. Ensuring adequate iodine intake is thus crucial for maintaining mental health and cognitive function throughout life. Iodine deficiency is a pervasive and often overlooked public health issue with far-reaching consequences. From thyroid dysfunction and reproductive health issues to cognitive impairments and increased cancer risk, the effects of inadequate iodine intake are profound and multifaceted. Addressing this deficiency requires a concerted effort from healthcare providers, public health officials, and individuals. Through education, dietary adjustments, and appropriate supplementation, we can combat this silent epidemic and improve overall health outcomes. Dr. David Brownstein's work serves as a crucial reminder of the importance of iodine in maintaining optimal health and preventing disease. By taking proactive steps to ensure adequate iodine intake, we can significantly enhance public health and well-being. Please like, subscribe, and share this video. If you enjoyed this, be sure to check out our next one right here.